My name is Marc Cribbs, and I'm the director of the Alabama Adult Congenital Heart Program at UAB. So there are a number of reasons why there is an expanding population of adolescents and adults with congenital heart disease. A few of those would include the care they are receiving by their parents once they return home from the hospital. For parents to become very well versed in knowing what subtle signs to look out for so that they can take them back to their pediatric cardiologist if there is a concern. The other part is the pediatric cardiologist, taking care of them in the outpatient setting and also looking out for complications that might turn up. You also have the care of the patient in the ICU once they return from the operation, and not to mention the surgical care they are receiving in the operating room itself. The surgeons have become very well versed in the treatments that they can provide, and surgeries are becoming more and more technical and more advanced. So the University of Alabama at Birmingham has a long tradition of caring for children and adolescents and now adults with congenital heart disease. Over the years, they've made strategic advances in caring for patients in the operating room, in the intensive care, on the floor, and then providing services when the patients are at home. Now we estimate there are 9,000 adults living with congenital heart disease in Alabama alone. So in 1940, the survival rate to 18 years of age was very low. It was only 20% of patients that were born with congenital heart disease. In 1990 and 1995, we saw that the percentage of patients living into adulthood reached almost 90%. And in 2013, we expect that over 95% of patients that are born with congenital heart disease are living to their 18th birthday and beyond. So in the early 1960s, the percentage of patients that were children living with congenital heart disease far exceeded the number of adults living with congenital heart disease. Back then, the ratio was around 70-30. So 70% of the patients living with congenital heart disease were children, and only 30% were adults. In 2000, we saw an even split right down the middle. 50% of patients with congenital heart disease were children, and the other half were adults. In 2010, we saw the pendulum swing even further towards adults, so that now there are more adults living with congenital heart disease than there are children. We estimate now that the percentage of patients living with congenital heart disease that are adults is now 60%, and the patients living with congenital heart disease that are children is 40%. I think the trend is heading towards a continued growth of the population of adults with congenital heart disease. And indeed, we expect that there are 20,000 adults entering into the adult congenital population every year.
Over the years, UAB has become a tremendous repository of patients with congenital heart disease who have had operations and come back for further therapy. There was a group of the pediatric cardiologists led by Mac who focused not only on small children, but they would follow these babies and children throughout their lives. And so they developed a large following, if you will, of patients who became adults with congenital heart disease who needed reoperations and further care. And so Mac and his colleague Ed Colvin, and then later a cardiologist named Walt Johnson, began to spend part of their time taking care of these adults with congenital heart disease. So it's perhaps not surprising that anytime you have a program with such a long history of serious involvement, that almost by definition that you're going to have a large cadre of patients who need care, surgical care, as adults.
I think that innovative care in the treatment of adult congenital heart disease is absolutely necessary. What we've learned is that the more operations that patients have for their congenital heart disease leads to an increased risk of prolonged time in the hospital, a longer time on the mechanical ventilator, renal dysfunction, stroke, and so forth. With each operation, there's also a higher risk of dying during that operation or dying during their hospital stay. And so now cardiologists and surgeons are working together to limit the amount of time that a patient with congenital heart disease needs to spend in the operating room. They're doing procedures that are so-called hybrid procedures. And that means that the cardiac interventionalist works together with the surgeon to take care of the patient to remedy a defect that might have otherwise required open heart surgery. They're doing that in the cath lab and using much less invasive means to repair the defect.
Many forms of congenital heart disease you can receive operations that are curative. There remains the substrate in the myocardium, the heart muscle, of fundamental abnormalities. And when you combine the potential problem of the surgical procedure itself eventually wearing out, if you will, valves put in that degenerate, conduits that are placed that gradually become obstructive, plus the underlying tendency for the heart muscle in some of these congenital malformations to be abnormal and get more abnormal as the years pass. And finally, the realization that maybe 30 to 50% of patients with congenital heart disease do not have a normal life expectancy despite having a surgical correction. They are vulnerable for other cardiac problems or worsening of their existing problems for the rest of their lives. If you couple that with the fact that most standard adult cardiologists have a very limited experience and understanding of the subtleties of congenital heart disease, you can see that you have a construct for these patients not getting really first-class care when they evolve into adults and they're in a small town or community that may or may not have heart surgery, but certainly doesn't have congenital heart surgeons or pediatric cardiologists. So for them to take advantage of what has already been done for them in terms of correcting their congenital heart disease, it's critically important that they be followed, and followed by people who are expert, because if they don't, they either die prematurely or develop complications which could be corrected and become eventually inoperable for a variety of reasons, because they've just waited so long without the availability of care that now their hearts are advanced enough in the stages of deterioration that we can't do anything surgically.
We now estimate that 60% of patients with congenital heart disease are lost to follow-up by the time that they reach their 18th birthday. And looking back before that age, we see that there are a significant number of patients that are lost to follow-up at even the age of 12 or even the age of 6. Continuation of follow-up is absolutely critical in patients with congenital heart disease. A number of complications can arise down the road that can otherwise be avoided if care is maintained. Some of those complications include abnormal heart rhythms, congestive heart failure, valvular disease, vascular disease. Coronary artery disease is also more common in the patient population who has congenital heart disease. In addition, patients can suffer from cardiac death. And unfortunately, sudden cardiac death is one of the more common presentations back to healthcare. A lot of research is going into figuring out why so many adults are lost to follow-up when they reach the age of 18. Some of those include the terminology that we use in the outpatient setting when they are children. In fact, one of the terms we use most commonly is the term repair. Tetralogy of flow repair, for example. Coarctation repair. And when people hear the term repair, they think of cure. They think that things will always be fixed and will always stay normal. And so if things will always stay fixed or normal, then why should they follow up with their cardiologist? Furthermore, if they had no symptoms, then why should they follow up with their cardiologist? One of the most common symptoms that occur in adults with congenital heart disease are palpitations. Many times those palpitations are caused by just a normal beating. People can be oversensitive to the beating of their heart. I think I would be too if I had had open heart surgery as a child. A lot of times those palpitations, however, are caused by arrhythmia. And what we notice is that there's a bimodal distribution of when those arrhythmias occur. In other words, arrhythmias tend to be more common in childhood, and also when the patient reaches the age of around 40, 45, or 50. So in that period of time when patients are in their teenage, early 20, 30-year-old age group, there are no symptoms really to speak of. And so, if they had no symptoms, why should they go to their cardiologist? I think a transition plan to usher patients from the pediatric to the adult congenital setting is absolutely vital. It would help to make sure that the patients know what to expect. Patients who have been cared for by a particular doctor like to stay with that doctor for years, and it can be traumatic switching from one doctor to another. It can be equally as traumatic switching from the pediatric setting to the adult setting, where care is often a bit colder, where the warm fuzzies that you get in the pediatric setting are no longer present. Transition programs can also make sure that things such as education about the defect are taking place. It can make sure that the patients are learning about the insurance that they should maintain, the types of jobs that they could take, the type of school that they should go to for college. All these issues revolve around maintaining care and maintaining their health. Transition plan needs to incorporate many things, but one of the most important things that it needs to incorporate is the emphasis on maintaining care. The emphasis that no matter how you might feel today, there could be issues that come up if you are lost to follow-up. Things such as arrhythmia, heart failure, vascular disease, and so forth. Not as a way to scare the patient to continue seeing their physician, but as a way of educating them so that they know what to expect. As a way of telling them, these are some of the things that we can avoid if you continue to see your physician. So at the University of Alabama, we have a number of places where patients can be seen with congenital heart disease. One of those locations is at the Women and Infant Center. There, Dr. Colvin and Dr. Johnson see adults with congenital heart disease. They also take care of children with congenital heart disease there. I see patients with congenital heart disease at the Kirklin Clinic, but I've come to realize that adults with congenital heart disease don't often have the means to travel from remote locations in Alabama to the city of Birmingham. It can also be quite scary to drive towards the big city and encounter a lot of traffic in a big hospital, a big medical center where parking is hard and where people are often running around. So in order to try to encourage patients to maintain follow-up, I've set up a clinic in Huntsville and also in Montgomery. And in that way, patients can travel a much shorter distance, a distance that doesn't break the bank, and travel to locations that they're much more familiar with, towns that are smaller and that they feel more comfortable with. The locations there are in outpatient medical complexes that have no big parking garage, that don't have a lot of craziness going on. Access to health care for adults with congenital heart disease is often limited. There are only a certain number of centers in the United States that can care for adults with congenital heart disease. While you may find a number of centers listed on the Adult Congenital Heart Association website, many of those centers don't offer the range of care that patients might need. They may offer an adult congenital clinic, for example, once a month, maybe once every other month. And really what patients need is a center that offers the full range of care. Care that includes electrophysiology, advanced imaging, cardiac cath, open heart surgery, and so forth. The other issue that occurs is that there are a limited number of adult congenital physicians. It takes a number of years to become trained to take care of adults with congenital heart disease. And in fact, once someone graduates from college, the training involves medical school, which is 4 years, residency, which might be 3 or 4 years, a fellowship in either pediatric or internal medicine cardiology, and then an additional fellowship in adult congenital cardiology. So sum total is around 13 to 14 years of training, including medical school. And for that reason, there are just a limited number of physicians that are there, that are available to take care of adults with congenital heart disease.
UAB is an interesting place with special opportunities for the patient with adult congenital heart disease. There are other programs in the United States that have superb adult congenital heart programs, but UAB is rather unique in several ways. So first of all is this huge repository of patients that are followed here that have given us unusual experience in how to deal with these patients surgically and from a cardiology point of view over a period since 1967. So that's going on 50 years of ongoing experience, which very few other institutions in the United States have.
The pediatric cardiologists whom I work with also take care of a number of adults living with congenital heart disease. There are a number of adult cardiology specialists who also care for this patient population. Aside from the physicians, we have a large group of nurses that help us do our jobs on a day in and day out basis. That doesn't include the technologists who are performing the echocardiograms, the cardiac MRIs, the cardiac CTs, or the physicians that are performing the invasive procedures in the cath lab itself. And then we have the surgeons. We are so fortunate to have 3 congenital heart surgeons here at the University of Alabama who can take care of patients when they need additional surgeries. We receive a number of referrals from community cardiologists in the state of Alabama. We also receive a number of referrals from Mississippi, Florida, Georgia, and Tennessee. And I think the reason why those referrals come is because these physicians recognize that UAB has the services available and necessary for adults living with congenital heart disease. Services that include advanced imaging, clinic services, lab draws, electrophysiology, important cath procedures, and of course surgeries. All that can be done right here at UAB.
Many of these patients receive an operation, they go about a reasonably normal life with reasonable functional capacity. And when things change, they change rather slowly. And so very gradually they become more disabled and limited. And there is a great need to disseminate knowledge about adult congenital heart disease throughout the state of Alabama and the Southeast, so that practitioners who aren't necessarily cardiologists, patients and their family, as well as adult cardiologists, begin to have an awareness of exactly what can go wrong with adult congenital patients, and that we have a facility here whose major mission is to provide care for them and consultative advice. And we see several times a week patients that come to Marc Cribbs or our adult cardiologists or even myself that other practitioners are just uncomfortable with the rarity of the condition and the unusual manifestations when they're getting worse. So it's very important that we get the message out that we have a capacity at UAB to provide unusually good care for these patients, and that they don't need to just gradually get worse, become more limited, and die from these conditions. That in fact, it's very standard for us to be able to add 5, 10, 15 more years of useful life to them if we know about them.
So looking to the future with regard to the Alabama Adult Congenital Heart Program, I envision that the program is only going to continue to grow. I think what adults with congenital heart disease is a department much like that of a pediatric or an adult cardiology department. A department that's comprised of individuals who care solely for adults living with congenital heart disease. electrophysiology physicians who are specifically trained in this field. Again, surgeons who are trained to take care of adults with congenital heart disease, nurses, advanced imagers, and so forth. Eventually, I envisioned a department that is solely for adults living with congenital heart disease.